let's chat a minute. I want to talk to you or expand our conversation about cardiometabolic health. Okay, so let's expand that conversation. So I want to give you a statistic. Did you know that 80% of heart attacks, strokes, and type 2 diabetes could be prevented? Okay? And the reason that they could be prevented if we caught the warning signs 5 to 10 years earlier. I can't remember where I read it, but it showed, this data that I read showed that most people who are diagnosed with diabetes, their complications started 10 years prior to the diagnosis. So the other scary part is that most of these symptoms or signs are not caught during routine checkups. This is why it is so important, and it's my mission for myself and my mission to help those who are 50 plus, or those who are Gen Xers and baby boomers, who, for myself and for those categories that I just gave out, it's a mission of mine is to optimize my health and my performance by reducing my reliance on the healthcare system. And all people can benefit from doing that. But I think so many people believe that cardiometabolic health, and I'm going to tell you what that is, it's just down to one number. We always hear about cholesterol. We always hear about our A1C or our blood glucose, and that's part of it, but it's not everything. And a lot of things, medical problems can be prevented if we would just be willing to do a little bit more advanced testing, that we'll be willing to make some small but very significant lifestyle and nutritional changes, be willing to take agency over our health and have full autonomy, and to ask questions, to read and to learn, listen to the biofeedback that our body gives us. But I'm just talking. So I want to break down cardiometabolic health. I'm reading, so that's why I'm not looking directly in the camera, but I will look over from time to time. And why it matters more than most people realize, and how you can start protecting your cardiometabolic health right now without waiting for a diagnosis. This is very key for me. Is a lot of times we put so much faith in doctors, and I thank God for those doctors who are willing and actually living up to their Hippocratic oath, which is to do no harm. There's a special place in heaven for those people, but unfortunately there's not that many. And the reason that I use therapeutic partners is because it is a partnership. You have to be in partnership with your doctor. And if you are not in a place where you feel comfortable with doing so, or you're silenced every time you ask the question, then I would encourage you to find another practitioner. But just like we are frustrated with doctors, doctors are frustrated with patients. You come in, they tell you that you have a problem, and you keep abusing the system and abusing yourself, and you asking somebody to fix something that you're chronically doing to yourself, right? So it's a broken system at best, and all parties have to come aligned and do their part in order for this to work. So what is cardiometabolic health? What is the big picture? Cardiometabolic health is the connection between your heart, your blood vessels, your metabolism, and your blood sugar control. Again, it's a connection between your heart, your blood vessels, your metabolism, and your blood sugar control. That's a lot. That's a lot of area. And I said earlier, most people only think about the cholesterol, but your cardiometabolic health is how everything works together. So you don't think about your heart as one unit, your blood vessels as one unit, your metabolism is one unit, and your blood sugar. Everything works together in order to provide harmony for your body. You got to think about, if you want to use this analogy, about the engine in your car. It's not the oil, just only the oil level. It's the fuel, the spark plugs, the airflow. If one is cut off, the whole system runs less efficiently, right? So it's a lot of things that keep your car running smoothly, and they work together in order so you can have a smooth ride. If one thing gets thrown off, you're going to get a check engine light, right? And so that's how you can think about your cardiometabolic system. It's all these different systems in the body working together to provide harmony. It's just not one factor. So when you go to the cardiologist, they're going to look at the major arteries of the heart, but they may not look at your endocrine system, your hormones. So you just cannot expect, and this is another thing that really irritates me about us taking care of our health. You just cannot expect one doctor to have all the answers. You have, I think it's 12 systems in the body, and you need to have someone that can manage pretty much all those systems and help you, support you in managing those systems. So when you think about your cardiometabolic health, is it in top shape? If it is in top shape, you'll have stable energy, better focus, fewer aches and pains. Everything will run together very smoothly. But if it's not, you're going to feel it, you're going to know it, you're going to know something is off if you're very intuitive to your body and you listen to the biofeedback that your body gives you. So the other point about having a robust cardiometabolic health is that it is a driver in aging well. Poor cardiometabolic health is linked to heart disease, stroke, type 2 diabetes, cognitive decline like dementia, and the list goes on. But when you keep your heart and your metabolism working together, your blood sugar stable, your circulation strong, you actually slow down the aging process. Now, who doesn't want that, right? A lot of times you'll see people exhausted, they're gaining weight, they're dealing with a lot of sugar cravings and things of that nature. And it's usually because one part of this robust system that we have, all these systems that we have in our body, something is off, right? And a lot of times, once you improve your blood sugar, you can improve and lower your inflammation. You can feel sharper mentally. You feel lighter because maybe you're not retaining water. A healthy cardiometabolic system gives you back quality of life, okay? Why do doctors often miss the early signs? The problem is most doctors only test for diseases. They don't look for root causes. They don't look at healing opportunities. Oftentimes doctors don't even want to talk to you unless you have a problem. Why? Because that's how they make their money. And then you have doctors that actually provide orders for you to have labs, and the normal ranges in some of these labs are they're subclinical, meaning you're on the borderline of your body functioning, but they just look down. If the lab didn't flag it, they didn't pay any attention to it, and they send you on your way, but you're really out of alignment. Your body is out of alignment. Let's talk about some common early red flags: fatigue, stubborn belly fat, poor sleep, sugar cravings. Most of the time it's often brushed off, especially for women. Once you hit perimenopause or even menopause, it's brushed off as that you're getting older. For men, oh, you're just getting older, it's no big deal. But they're really warning lights on the dashboard. And so if you, as an individual, will take agency over your health and get involved in the decision-making process, learn how to eat healthier, learn how to read a nutrition label, learn how to cook from home, learn about seed oils, learn about processed foods and sugars and things of that nature. Just real basic things that you can learn on YouTube. It doesn't take a whole lot to figure some of this stuff out. And then pay attention when you make some of these changes of improvement. How does my body respond? So what can you do today? I shared in a video about taking your blood pressure at home. You can go back and look at that video, and then I'll put it in this description, and in that video as well, I'll put in a description of a blood pressure monitor that you can actually use, the one that I use. You can actually go and have your lab testing done. So say for instance, you actually don't have a doctor right now that you're seeing, but you wanna know your numbers. Places like Quest Labs allow you to purchase kind of a la carte, if you will, specific things. If you want a comprehensive metabolic panel, or if you want to just know your A1C, you want to just get your lipid panel done, you can just buy specific tests. And I think they add maybe like a $6 fee, a minimal fee for a doctor to interpret those labs on your behalf. And that way you can get a starting point if you don't actually have a relationship with a doctor's office. Now, there are so many independent labs that you can go to now that you can bypass insurance, even if you don't have insurance and you have to pay out of pocket. It's not that much money for you to get this information about your health up until the point that you can actually find a doctor that you want to work with. We talked about your fasting blood sugar. That is a great number to know. Your fasting blood sugar and your A1C is two great numbers to know. And I know for a fact that you can actually purchase those from Quest. Like I said, it's like a menu that you can go in there and pick from and look at the descriptions of the test to see what you want to know. And you pay that fee, go into the lab center. You know, you can find a center closest to you and go and have the test done, so you can know your numbers. That way you can have data to know what you need to improve on. You get yourself a starting point. Cardiometabolic health is the foundation for a vibrant and independent life. You want to be independent. You do not want, I don't want to live the rest of my life or as I age and have to be reliant on someone taking care of me. I want to be independent. I want to live on my own. I want to have a vibrant life. And so that takes some sacrifices, right? The earlier you take charge of this, the more years of energy, clarity, and focus and freedom you can have. And it brings to mind to me when I'm traveling a lot to see people who unfortunately are in wheelchairs or have some type of disability, people who are very much overweight, sitting in plane seats. And here recently, I came back on a flight, and there was a gentleman sitting next to me, and he was a big guy, and he had those Apple Beats on, and he was playing some type of game on an iPad the whole time, but he was so large from the front and from the back, he couldn't sit back. And this particular leg of my flight was 4 hours, so he could not sit back in the chair. So essentially, he sat up like this the whole flight. And he had the iPad in his lap, and I could hear him snoring. So he would doze off to sleep for a little bit, and then he would catch himself. But even when he would catch himself, he couldn't sit back and relax. And I thought about it. I said, this has to be so uncomfortable for this man to be like, have to sit like that. But he couldn't do anything else to sit like that for 4 hours. You know, how uncomfortable he has to be. Like I said, he had weight in front of him and he had weight behind him. And so he had almost like this pad between his shoulders that would not allow him to sit back. And that had to be very uncomfortable for him. So weight loss is another issue. It's another thing that impacts your overall health. We talk about it in a point of putting people down, but don't understand as you get older, you want to be as lean as possible. You want to hold on as much muscle as possible, but you want to reduce that body fat, not necessarily lbs on the scale, because they're not always linear, because everybody chases weight, but that body fat is what gets us in trouble. You want to try to reduce your body fat as much as you possibly can as you get older. It will benefit you greatly if you can do that. And I want to just share and encourage you again to learn how to optimize your performance and your health, right? Your journey may look different from mine, but we all have a journey. I want to encourage you to watch all the videos that I put up. Hopefully, I can make this like a series. If you all have any questions about your cardiometabolic health, it's kind of a hard word to say. If you have any questions about your cardiometabolic health, please leave it in the comments below. And I look forward to seeing you in the next video. Let's take charge over our health. Be blessed.